Younger children can now get the same updated COVID-19 booster shots that have already been available to older kids. Here to answer your questions about that, Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Great to see you, doctor.
Hey, Dr. Moffatt, how are you? Good to see you. So, as you know, these shots are designed to target the Omicron strains that are circulating right now. So what can you tell parents about how well they work?
Yeah, well, what we know so far really is only based on what's called immunobridging data. And what that means is that when these Omicron adapted boosters were tested in adults, they generated much higher neutralizing antibody levels against Omicron strains than did boosting with the original vaccine. We have to remember that these bivalent boosters, these updated boosters, have only even been available for adults and authorized in September. So we should have more in real life effectiveness data forthcoming in the next 1 to 2 months. But based on what we know from prior studies and how immune responses correlated with effectiveness, we would expect that someone receiving this booster should have very significantly enhanced and better protection against the BA4 and BA5 Omicron variants for at least several months after getting this new booster.
Something you'll keep an eye on for sure. So let's talk about these two new options. Pfizer is now authorized for kids as young as 5. Moderna is approved for kids as young as 6. So I know we're looking at this question, but can you answer that question? Is one better than the other before we get to that question?
Yeah, we'll get to that one in a minute.
Yep. Sure. Yeah. I mean, there's not really a huge difference in the brands. So far, we're about 2 years into studies with these 2 mRNA vaccine brands so far, and there's really not been any super convincing study to suggest that one is clearly better than the other. Maybe we'll get more data to come with these updated boosters, but not as of right now.
All right, Dr. Moffatt, let's go back to the question that you just saw on the screen. And this is from Meg. And Meg asks, my daughter has had minor cold symptoms for a few weeks now. It's not COVID or the flu. Can she still get the booster, or should we wait until her runny nose is no longer running?
Yeah, it's a really good question. That runny nose can last for a really long time. So there's not really a need to wait until the runny nose is completely gone. As long as she's not having fevers and she's otherwise returned to feeling pretty much herself, it would be safe for her to go ahead and get the booster.
All right, doctor, here's another one. This one is from Kyla. When do kids get the most antibodies from the booster? We're hosting Thanksgiving this year, so I was thinking about scheduling their shots in early November. Good idea, bad idea? When should they do it?
Yeah, it's a great question. Well, what we know about these antibody levels and when they're the highest really comes from how they've been studied. And most of the studies have looked about 3 to 4 weeks after getting a booster. And that seems to be the time around which those neutralizing antibody responses seem to be the highest. So I would say that probably getting those boosters scheduled anytime in the next couple of weeks here, so second half of October, should have them really at kind of peak immunity around the time Thanksgiving rolls around.
And just as a reminder, folks, Thanksgiving is the 24th this year.
I know.
The 24th. And so it's not later in the month. It's
Really
earlier. Dr. Moffatt, thank you so much. Great to have you.
Stay well, doctor.
Sure.
Thank you. We always appreciate you. And to our viewers, if you have COVID-related questions that you would like our experts to answer, email them to ask@wcvb.com.